It's time for Wednesday Night Live. Hello, CNAs and nursing students. In tonight's practice test, we're going to be reviewing diabetes. So go ahead and get your pen and your papers together, and we're going to get started shortly. Welcome to today's lecture on diabetes, everyone. As CNAs and nursing students, you will likely encounter many patients with diabetes. So it's crucial to understand what diabetes is, how to recognize its signs and symptoms, and how it's treated and managed. We will also explore the complications that can arise if diabetes is not well controlled. So, what is diabetes? Diabetes is a chronic medical condition that affects how the body processes glucose, aka sugar, the main source of energy for our cells. Normally, the pancreas produces a hormone called insulin that helps to regulate how the sugar enters the cells for energy. However, in people with diabetes, the body either doesn't produce enough insulin or cannot use insulin properly, leading to high levels of glucose in the blood. And that is what we mean when we say hyperglycemia. Let's cover the types of diabetes. So, type 1 is in which the body does not produce insulin at all, or it doesn't produce a sufficient amount. It is usually diagnosed in children or young adults. Patients with type 1 diabetes require lifelong insulin therapy. So write those notes down. Type 1, the body does not produce insulin. It's usually diagnosed in children. So that's what they refer to as juvenile diabetes. And they're going to require lifelong insulin therapy. All right, so this is types 2 to type 3, and I'll talk about the differences on this slide. So type 2 diabetes that's when the body doesn't use insulin properly. The person has insulin resistance, or the body doesn't produce enough insulin. This is more common in adults, and it is linked to obesity, inactivity, and poor diet. Type 2 can sometimes be managed with lifestyle changes, but people may also require medications, and we'll call those oral anti-diabetic medications. So if a patient takes a pill to control their diabetes, that is what we're referring to, or if they need the injections, that will be insulin. In type 3 diabetes, a lot of the professionals are now calling that Alzheimer's disease. So when the sugars have gone uncontrolled for too long, type 3, that's when you start having long-term or chronic cognitive issues. An additional type of diabetes is gestational diabetes, and this occurs during pregnancy and usually resolves after childbirth. It increases the risk of the mother developing type 2 diabetes later in life. And I see everyone saying hello in the chat, so hello, happy Wednesday. All right, so what are some of the signs and symptoms of diabetes? First, frequent urination, or we call that polyuria. You know how I like for you to learn your medical terms, so break it down. Poly means more than, urea referring to the urine. So this happens when high blood sugar levels cause excess glucose to spill into the urine, leading to frequent urination. Polydipsia is increased thirst. As the body loses more water through urination, the patients often feel very thirsty. Another sign could be unexplained weight loss. Despite eating normally, patients with type 1 diabetes may lose weight as their bodies start breaking down fat and muscle for energy. They can also be extremely hungry because the body isn't able to use the glucose. It's just sitting in their cells. It's not being utilized for energy, and thus that's going to cause them to be hungrier more often. Fatigue or lack of energy. Remember, if you don't have sugar, well, you're going to feel tired, okay? Blurred vision. I want you to write this note because you may see this again. Hint, hint. High blood sugar levels can affect eyes. And so whenever someone's sugar is high, a symptom that they could have would be blurry vision. Slow healing sores or frequent infections. Poor blood circulation and high blood sugar can impair healing and the immune response. So especially if it's a woman, they can have yeast infections more often, or maybe they have cellulitis. And if they do get a sore, it's going to be harder for them to heal. Tingling or numbness in the hands or feet, especially in type 2 diabetes, this is a sign of nerve damage or neuropathy. Go ahead and say that word with me, neuropathy, a common complication of long-term diabetes. Yes, diabetes has a lot of signs and symptoms and complications. So here's a huge one. This one's a medical emergency. It is called diabetic ketoacidosis, or we call it DKA. And this is more common in type 1 diabetics. Again, DKA is a life threatening condition where the body breaks down fat for energy, thus producing harmful ketones. And so signs include fruity smelling breath. I promise once you smell it once, it kind of smells like they had been chewing the bubble gum juicy fruit. And so if you smell that and the person has not been, eating anything fruity, more than likely they have DKA. You're not going to tell your patient that, but it's just something that you can be looking out for. Another sign of DKA will be confusion, vomiting, severe fatigue. Of course, if you notice any of those symptoms, you can stay with the patient if you're truly concerned, but you're going to notify the nurse and get that nurse into the room right away. Another complication is heart disease and stroke. So that's why we have to stay healthy for as long as possible, you all, because getting a diagnosis like diabetes can actually cause you to start having heart disease. So diabetes significantly increases the risk of cardiovascular issues due to high blood sugar. It damages the blood vessels. Nephropathy or kidney damage. So nephro meaning kidney, and then the pathogy or the pathy, that means that we have a problem with the kidneys. So nephropathy is, it comes from long-term high blood sugar that can damage the kidneys. It can lead to kidney failure, and those patients may require dialysis. And the image there shows a dialysis machine. Remember that the kidneys actually purify the body, removes the toxins from the body. And so if the kidneys are not working, that means that they're going to have too much potassium, too much of the good stuff is going to be in their body, and it's going to turn their body toxic. So how do we get rid of it since their kidneys aren't working? They have to start going to dialysis. So long-term diabetics, those who've not taken care of their blood sugar, they can get severe kidney damage that will require dialysis. And then we've talked about it briefly, the nerve damage or neuropathy. Remember, we had nephropathy, and now this is neuropathy. So this is when high blood sugar levels can cause damage to the nerves. And this can lead to pain, tingling, or loss of sensation, especially in the feet. That's why we're so careful. We'll be like, hey, when someone has diabetes, they have to have their shoes on. We make sure they check the water temperature with their hands and their feet, because if they've lost sensation in their feet, they're going to be less likely to feel if the water is too hot. And so whenever they have neuropathy, this increases the risk of infections and amputations. Eye problems or retinopathy. Diabetes can damage the small vessels in the eyes, leading to blindness if untreated. And then foot problems. We mentioned it before, but poor circulation and nerve damage can result in foot ulcers, infection, and in severe cases, amputation, because the infection gets down to the bone. And even with the best medical care, poor circulation, chronic infections, sometimes they will have to have that part of the limb that is infected amputated or removed. All right, so what are some of the treatments? For type 1, yes, there's insulin therapy. Patients need daily insulin injections and or an insulin pump. Monitoring blood sugar levels throughout the day is crucial. And yes, they're going to be encouraged as far as diet and exercise is concerned. They're going to need a balanced diet and regular physical activity to help regulate blood sugar. For those who have type 2 diabetes, lifestyle changes, lifestyle changes, lifestyle changes. Look, if they lose weight, if they adopt a healthier diet and regular activity, they can actually improve their insulin sensitivity and help control their blood sugars. Yes, they can even get off of insulin or off of their oral anti-diabetic medications. And so we mentioned the oral medications before, but there are going to be medications like metformin that can help the body use insulin more effectively. And then, of course, we talked about the insulin injections. And why, as a CNA, why do you care about all of this? Because we have a large population of patients who have diabetes. And so you are part of the medical team. And so whenever your nurse is telling you something or you're hearing terms, I need for you to know what those terms mean. We say someone's getting insulin. Well, now you're going to know they're going to be getting an injection. So when your nurse says, hey, did you check the blood sugar? Because I need to give them insulin, you're going to move a little bit faster. All right, and so additional treatments would be blood glucose monitoring. And so patients use glucose monitors or continuous glucose monitors to check their blood sugar levels regularly. So even if a patient did have some type of continuous monitor, in most of your hospital sectors, the nurses and the PCTs, they still would do finger stick blood sugars. And that's a term you're going to see as we start our practice test. So finger stick blood sugars, that's what you see on the image there. Whenever they poke the finger, they're going to collect a sample of the blood, and the glucometer is going to give the blood sugar reading. And dietary management. Patients should follow a diabetic-friendly diet that includes low glycemic index foods, fiber-rich vegetables, lean proteins, and healthy fats. Carbohydrate counting is often required. So they could be limited to like a 16 or a 1200 calorie ADA diet. And that stands for American Diabetes Association. They set the regulations or guidelines for the ADA diets. So if you see that as a patient's meal, that means, if you see that for your patient's diet type, 1600 ADA, that means that they're on a calorie or a carbohydrate reduced diet. We talked about regular physical activity. Let's talk about that foot care. So proper foot care, including regular inspections and wearing proper footwear. Look, I live in Florida. If you're a diabetic or if you have a patient who's a diabetic, at no point should they have on flip-flops. They have to have on shoes that protect their feet. It is essential to prevent infections or ulcers. And then blood pressure and cholesterol control. If the patient can manage these through diet, exercise, and medication, it will help to reduce the other complications. Remember, if their cholesterol is high, well, that's going to worsen their cardiovascular health. What is your role? I know you're like, Nurse Eunice, you've been talking for 5 minutes now. What do I need to know? So what is your role if you're a CNA or a patient care tech and you're taking care of a diabetic patient? Monitoring blood sugar levels, it depends on where you work. So I'm going to restate that. Depending on where you work, CNAs may assist patients in checking their blood glucose levels and report abnormal readings to nurses. You also, whether you're a CNA, a PCT, a home health aide, it doesn't matter. You're going to be one of the first persons to recognize signs of hypoglycemia or low blood sugar. And so early signs include sweating, shakiness, confusion, and dizziness. Severe hypoglycemia can lead to unconsciousness, and it's important to respond quickly by giving a fast-acting sugar source like juice or glucose tablets if the patient is alert. And of course, you would not be doing this without your nurse telling you to do so, but at least you know what to do once we start that ball rolling. You're going to help your patients promote a healthy lifestyle. You're going to encourage them to stay active, eat healthy meals, and maintain proper foot care. You're also going to recognize early signs of complications. So as a CNA, as I mentioned before, you're often the first to notice changes in patients' conditions. So report any signs of infection, poor circulation, or abnormal glucose levels to your nurse right away. And now is the time, everybody. Let's get ready for our practice test. So get ready for your practice test on caring for patients with diabetes. This review that we've already completed will help cover essential diabetes care, including blood sugar management, recognizing symptoms, and understanding key treatments. Focus on identifying complications like diabetic ketoacidosis and hypo or hyperglycemia. Question number 1. What is the primary role of insulin in the body? Is it A, to increase blood sugar levels, B, to help glucose enter the cells, C, to break down fats, or D, to store proteins? All right, I see some correct answers coming through, and I'll reveal the correct response in 3, 2, and that is right. It is B, to help glucose enter the cells. So insulin allows glucose to enter the cells where it can be used for energy. Without insulin, glucose stays in the blood, causing high blood sugar levels. Question 2. Which of the following is a common symptom of hyperglycemia? Is it A, shakiness, B, sweating, C, frequent urination, or D, low energy? Let's see if you remember from our review. What is a common symptom of hyperglycemia? Oh, we're a little torn. Remember, this is hyper, not hypo. And that is right. You are correct. So whenever a patient has hyperglycemia, it's going to be C. Remember polyuria? They can have frequent urination. High blood sugar levels cause the body to try to remove excess glucose through the urine, leading to frequent urination, also referred to as polyuria. Question 3. Type 1 diabetes is best described as A, the body's inability to use insulin properly, B, insulin resistance due to obesity, C, a temporary condition during pregnancy, or D, a condition where the body does not produce insulin. Do you understand type 1 diabetes versus type 2? And then remember that even if someone has type 1 or juvenile diabetes, they grow up and they're going to be an adult who still has type 1 diabetes. Okay, so yes, you have the correct response. You are absolutely correct. It is D. Condition where the body does not produce insulin. So they're not going to be on oral anti-diabetic agents or medications that can be taken orally. They're going to have injections. So in type 1 diabetes, the pancreas does not produce insulin. Thus, they require lifelong insulin therapy. Question 4. Which type of diabetes is most commonly linked to lifestyle factors such as obesity or inactivity? Is it A, type 1 diabetes, B, gestational diabetes, C, type 2 diabetes, or D, juvenile diabetes? And I am so proud of you. I see you all in the comments saying that you passed your examinations. I ran into a young lady today who she heard my voice and realized it was me. And she told me that she used my videos exclusively to study. Her name was Valencia. So congratulations on passing your exams, Valencia. And yes, for question number 4, you have it. That is right. It is C, type 2 diabetes. Type 2 diabetes is often associated with lifestyle factors, including obesity, poor diet, and lack of physical activity. Question 5. A patient with diabetes complains of blurry vision. What could this indicate? Is it A, low blood pressure, B, nerve damage, C, dehydration, or D, high blood sugar levels? And I expect everyone to get this one right. I know you're going to get this one right. Hold up. Let's see what's happening right there. Great job, team. Revealing the answer in 3, 2, and yes, it is D. Are you proud of you? Because I'm proud of you. High blood sugar can affect the small blood vessels in the eyes, leading to blurred vision and, if left untreated, even blindness. Question 6. What is a common complication of long-term uncontrolled diabetes? Is it A, stroke, B, liver disease, C, anemia, or D, appendicitis? And I'm so excited for you all as you start your careers in healthcare. I know it's going to be challenging, but it's so rewarding. I've been a nurse now for 20, 26, almost 27 years. And so I'm telling you, it's so much that you can do once you enter the nursing or medical field. So even if you're starting off as a CNA, the opportunities are endless. And the answer is A. You got it, Tasha. You have it, Naiji. I see you all. Great job. So it is A, stroke. Uncontrolled diabetes increases the risk of cardiovascular issues, including stroke and heart disease due to damaged blood vessels. Question 7. Which of the following is not a typical symptom of hypoglycemia? Is it A, shakiness, B, sweating, C, confusion, or D, frequent urination? Again, the question says which is not a typical symptom. And you are right. For hypoglycemia, it is not D. Remember, frequent urination is a symptom of hyperglycemia. Hypoglycemia symptoms include shakiness, sweating, and confusion. We call that diaphoresis. Whenever they start sweating, they can become really pale, and they could actually become really hard to arouse. All of that would indicate a medical emergency. You stay with the patient and get that nurse in the room right away. Question 8, how should CNAs respond when they notice early signs of hypoglycemia in a patient? And now this, of course, is under the nurse's direction. Is it A, give the patient a sugar-free beverage or sugar-free snack source? B, give the patient a fast-acting sugar source? C, have the patient take more insulin? Or D, wait and reassess in 30 minutes? Which of these directives do you think that a nurse would give? Which of these orders? And you have the correct answer, and you have the correct answer. That's right. I'm going to tell you that, hey, Lucas, go and get the orange juice. It is B. So provide a fast-acting sugar source. We're not giving them anything sugar-free. And so that could be juice. You as a CNA would not have access to glucose tablets unless this was a home care patient. But whenever we give them a source of fast-acting sugar, it acts to quickly raise the blood sugar. Remember, CNAs must inform the nurse and obtain an order before administering any fast-acting sugar. And then patients with severe hypoglycemia may need IV dextrose for treatment. So if they're unable to speak, if they don't have a gag reflex, I'm not going to be asking you to get them anything that they'd be taken orally. I'd have to call the doctor, get an order. If they don't have an IV, get one started, but they're going to get intravenous dextrose. All right, great job, team. Question number 9. Ooh, this one's about diabetic ketoacidosis. So DKA is most commonly seen in which patient type? Would it be a patient with A, type 1 diabetes, B, type 2 diabetes, C, gestational diabetes, or D, pre-diabetes? And I hope that this video just really encourages you to take better care of your health, to limit those sweets, to eat more healthier foods, to exercise more, because we have to stay extra healthy, especially with everything that's going on right now. I want you all to be healthy caregivers. And so, yes, DKA is more commonly associated with A, type 1 diabetes. It occurs when the body starts breaking down fats for energy, thus producing harmful ketones. Number 10, a patient with type 2 diabetes is likely to be treated with which of the following? Is it A, only insulin, B, only lifestyle changes, C, oral medications, lifestyle changes, and possibly insulin, or D, surgery to remove part of the pancreas? Yeah, couldn't trick you all. Type 2 is going to be C. So type 2 diabetes is often treated with a combination of lifestyle changes, oral medications, and sometimes insulin. So you all know that. Number 11. Which of the following is a long-term complication of poorly managed diabetes? Would it be A, nerve damage, B, vision improvement, C, increased immunity, or D, faster wound healing? Yes, we talked about neuropathies, remember? So it's A, nerve damage. So poorly controlled diabetes can lead to neuropathy or nerve damage, especially in the feet. Number 12, a key dietary recommendation for a person with diabetes is A, high sugar intake, B, low fiber intake, C, low glycemic index foods, or D, high fat diet. And for those of you all who are saying you have tests coming up in the near future, of course, we're praying for you, wishing you much success. If you need to get something over to our office, let's say your past test scores, or if you have questions, our email address is admin, that is ADMIN, at fltraining.com. Again, that is admin at fltraining.com. If you need practice tests, you can go to fltraining.com to scroll down on the main page, and you're going to see a box that says download your free practice test. All right, so yes, the answer is C. Low glycemic index foods help control blood sugar levels by preventing spikes in blood glucose. Question 13. How does regular physical activity benefit diabetic patients? A, it allows patients to eat more sugar. B, it reduces the need for insulin. C, it stops progression of diabetes completely. D, it lowers blood sugar by increasing insulin sensitivity. Look, don't let those big words distract you. Whenever someone's moving more, they're going to have better regulation of their blood sugars because that is right, you all. The answer is going to be D. Let me make sure that's right. Yep. It lowers blood sugar by increasing insulin sensitivity. Question 14. What is one of the first signs of diabetic neuropathy? Is it A, muscle spasms, B, tingling or numbness in the feet, C, hair loss, or D, frequent headaches? And I know you're going to get this one right. I know you're going to get this right. Yes, 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 it is B. So diabetic neuropathy often starts with tingling or numbness in the extremities, particularly the feet. Question 15. What is the primary treatment for type 1 diabetes? Is it oral medications, lifestyle changes, insulin therapy, or surgery? You are absolutely correct. Great job, team. It is C, insulin therapy. Remember, as a CNA, you cannot give insulin, but if you have a patient who's a resident who's maybe in a group home, assisted living facility, or home care, you can provide them with their reminders. If they can draw up their medication, you can hand them the alcohol swab. But a CNA or a patient care tech, you're not allowed to give injectable medications. So type 1 diabetes require daily insulin therapy because the body does not produce insulin. Question 16. Foot care for diabetic patients is important because A, they are more likely to injure their feet. B, poor circulation and nerve damage increase the risk of foot ulcers. C, diabetes increases foot hair growth. Oh my. D, feet are more prone to fungal infections. So why is foot care important for diabetic patients? Absolutely, it is B. And diabetic patients often have poor circulation and neuropathy, which increases the risk of foot injuries and slow healing ulcers. We're going all the way to 25, team. Thank you all for studying with me. I'm so proud of you. Question 17. A key feature of gestational diabetes is A, it occurs after childbirth. B, it is linked to obesity. C, it resolves after pregnancy. Or D, it is a permanent condition. Yeah, believe it or not, whenever a mother is pregnant, it's not linked to obesity. So it is C, gestational diabetes. It usually resolves after pregnancy. So they could be a normal weight and their blood sugars are still going to be elevated. So gestational diabetes occurs during pregnancy and typically resolves after the baby is born, although it increases the mother's risk of developing type 2 diabetes later in life. Number 18. Which of the following is a non-medication treatment for type 2 diabetes? Is it A, insulin injections, B, bariatric surgery, C, dialysis, or D, diet and exercise? Yes, you have it. Yeah, we're going to get them up, get them moving about. Hey, Mr. Lucas, do you want to walk around the floor today? It's going to be D. Diet and exercise is the first line of treatment for type 2 diabetes because it helps patients manage their blood sugar levels without medications. Number 19. What is the significance of blood glucose monitoring? Is it A, it helps adjust insulin doses and manage diabetes? B, it prevents all diabetic complications? C, it replaces the need for insulin? Or D, it is only required in severe cases of diabetes? What is the significance of blood glucose monitoring? That is a right, team. It is A. So, regular blood glucose monitoring is essential for adjusting treatment and managing blood sugar levels, which is why we usually have you check the blood sugars if that's part of your job function before meals and at bedtime, because we don't want anyone going to sleep if their blood sugars are low, because that means they may not wake up. So, usually for your diabetic patients who are stable in your facilities, blood sugars are checked at least 4 times a day, before meals and before any insulin is given, and then right before bedtime. And make sure that your diabetic patients, unless otherwise noted, are able to, that they actually get their diabetic snacks, their bedtime snacks, because we again don't want their sugars dropping overnight. Question 20. Why is it important to wipe away the first drop of blood during a FSBS, stands for finger stick blood sugar, during a finger stick blood sugar test? Is it A, the first drop is always contaminated? B, the second drop hurts less? C, the first drop may be diluted by tissue fluid? Or D, it makes the test faster? Why do we wipe away the first drop of blood? I know this one's hard because I didn't talk about it. But yes, the first drop may be diluted. It is C. So the first drop can mix with tissue fluid. It's kind of like the yellowish fluid, and it can affect the testing accuracy. Remember, the blood should be dark red. If it has any mix of something that appears to be lighter, go ahead and wipe that away, because that is tissue fluid. That's not the capillary blood. Question 21. Diabetic patients are advised to check their feet regularly because A, diabetes can cause foot hair loss. B, it helps regulate blood sugar levels. C, diabetes makes the feet larger. Or D, small injuries can go unnoticed due to nerve damage. All right, and so we're not even going to hesitate. We know this one is D. But that's why you have to be checking their feet. Look, if they're having visual difficulty because their sugar levels have affected their eyes, now they're getting older and they have mobility issues, so they can't get their feet to their face to see what's going on with their feet. You are going to be the person who actually helps to protect their health. So make sure you're doing a foot check. You do skin checks, you do feet checks to make sure there's no cracks, there's no, infected toenails. You see any of that, please let your nurse know. And here's our rationale. Nerve damage or neuropathy can make it difficult for diabetic patients to feel injuries, thus increase the risk of infections and ulcers. Remember, if they can't feel it and they can't see it, by the time they even know about it, it could be a severe infection that could lead to amputation. Question 22. When collecting a finger stick sample, which area of the finger should be used? All right. And if you ever get a chance to, actually prick your own finger, you're going to teach yourself a lesson. So, are you going to stick your finger A, the middle of the finger pad, B, the side of the fingertip, C, the tip of the nail, or D, the knuckle area? And it's sometimes good for you all to experience what your patients go through. Okay. It'll make you a kinder, more gentler caregiver. So if you've ever been stuck in the center of your finger, you know that hurts like heck. So it is never A. It is going to be B, the side of the fingertip. It's less painful and gives a better blood sample. 23. What should a CNA do if the patient's hands are cold before the finger stick? Is it A, use alcohol to warm the hands? B, place their hands in hot water? C, squeeze the fingertip hard? Or D, ask the patient to rub their hands together? Right. It's just the weather's changing. You go into the patient's room, their hands are cold, and you have to do this finger stick blood sugar check. What are you going to have your patient do? Are you going to have them place their hands in hot water? All right. So this is Mitch's Mitchell, and if you put her hands in hot water, she's going to fuss at you. So the answer was not B. The answer is D. You're going to say, hey, Mrs. Mitchell, my name is Eunice. I'm your CNA day today. I'm here to check your blood sugar level. Is that okay? Before I begin, let me go wash my hands and put on my gloves. You do all that. You get your machine ready. Miss Mitchell, can you go ahead and just, rub your hands together so we can try to get them warm before we begin our test? And so warm hands helps to get the blood flow without causing tissue damage. Question 24. A patient's blood sugar shows 98, milligrams per deciliter. You all, that's a normal blood sugar reading. So normal, depending on your facility, is anywhere from 80 up to 110. Okay. If they had to do a fasting reading, like 70 to 100 is good. But their blood sugar reading is 98, which is a normal reading. The patient is pale and says, I feel like my sugar is dropping. What should you as the CNA do first? Is it A, ignore it because the number is normal? B, check the machine again later? C, report the symptoms to the nurse immediately? Or D, give the patient candy? All right, what do you think, team? This one's a little more trickier, and it's actually real life. And I see the majority of you all have it right. That's right. Whenever there's a change in condition, we're getting that nurse in the room. The answer is C. Symptoms always matter. Look, we don't treat numbers, we treat humans. Even if the blood pressure is normal, but your patient says, I feel dizzy, we don't treat numbers, we treat humans. You get your nurse in the room. So the same is true for diabetic patients, their glucometer readings, their blood sugar readings. I don't care what that machine says. If that patient says something different, get your nurse in the room, because patients can have hypoglycemia symptoms even before the numbers drop too low. So you have to notify the nurse right away. The patient's telling you, hey, I don't feel good. And I bet if you came back 10 minutes later and rechecked the sugar again, if the nurse didn't come in and intervene, now the reading has caught up with what the patient feels. And now the reading is going to be lower. So it's just best to err on the side of safety and trust your patients, because they have to deal with these conditions. You don't. Question 25. Which of the following should a CNA document after performing a finger stick blood sugar? Is it A, only the number, B, only the time, C, the blood sugar result and time, or D, the blood sugar result, time, and any symptoms? And of course, we're going to document the date. That's a given. And you get an A, and you get an A, and you're absolutely right. The answer is D, you all. We're going to document the time, the reading, the symptoms. If there's anything abnormal or unusual, you're going to document that. But if it's something you're really concerned about, you're going to let your nurse know before you document it. That way your documentation can say nurse notified. All right, guess what, everybody? We did our 25 questions. Whoa, I'm so proud of you all. If you stayed to the end of the video, I know this one was a little bit longer. If you stayed to the end of the video and you haven't liked, shared, or subscribed, let me tell you, go ahead and do so. So we're in the process of moving right now. We have 2 units that are, it's a lot. So I do apologize for not being on sooner. For our scrub buddies and scrubs and ambition, our members, my focus this weekend is to make sure that you all get a private video. So I thank you all for giving me grace, because this has been a lot trying to move into a larger facility. Yeah, it's a lot going on, but you all know that I love you. I appreciate you. And guess what? Thank you for watching. Don't forget that if you have a question regarding your test, I'm really going to have to utilize my team this week. I need you to send an email to admin@fltraining.com. If you failed your test and you need just someone to look at your scores to give you a customized plan, we will do that for you. It's free of charge. We are here to help you succeed, to help you be the best caregivers possible, and to, just to let you all know that you all have support. So wherever you are in the world, know that Nurse Eunice and Florida Training Academy, we love you, we value you, and we thank you for being a wonderful caregiver. Good night.